I'm going to introduce Erin Colvin, who is our APP supervisor for the Heart Institute, and she's going to be giving us patient perspectives as her talk.
Thanks, Yvonne. Good morning, everybody. So I'm going to be talking today about patient perspective, how we can support our patients and families during surgery for complex transposition. Having a child diagnosed with congenital heart disease and hospitalized for cardiac surgery is a very stressful experience for any caregiver. The time surrounding the surgery is often thought to be chaotic. It leaves caregivers with feelings of uncertainty, confusion, and helplessness. Milo's mom, Leanne, told me it was very overwhelming preparing for his surgery. We were traveling to have surgery with a new team in a city that we had never visited before. Children are particularly vulnerable to stress associated with invasive medical procedures. This has been studied. Other studies have documented frequent and persistent severe distress reactions after aversive hospital experiences. Noah's mom said, I was so worried about how was my child going to handle this hospitalization? The thought of having open heart surgery is often terrifying for our patients and families. And I think as care providers, it's very important for us all to recognize this. This is why we see, some of the things that we do when families are stressed and they're overwhelmed. They have anxiety, they're nervous, they have tension. All of those things come to play. One mom said, we always knew she was going to need open heart surgery, but hearing it was time to schedule was one of the most overwhelming moments of my life. Ethan's mom, it was scary not knowing what was going to happen the day of surgery, and I became very frustrated. Preparation is key for all of our families. Centers should have a set preoperative preparation plan, and this is there in order to help decrease anxiety, improve cooperation of the patient as they move through the different, the ICU stay, the acute care stay, enhance the recovery. It increases a sense of mastery and self-control for parents and patients. It enhances trust between patients, families, and caregivers, and the healthcare providers. When families understand what's going on and they've been spoken to, they're more trusting and they feel like they're part of the team. It also improves long-term emotional and behavioral adjustments in patients and families and caregivers. So what does this look like? Preparation has to begin with an assessment of both the child and the family. This assessment and preparation needs to be done prior to the morning of surgery. So oftentimes this is done even before they come to the surgeons. It's done by the cardiologists. And our team, that information is communicated to us if there are life stressors in the family, if there are neurodevelopmental issues. It's very important that communication happens so that we can tailor our education and our preoperative preparation for the patient and the family. Bradley's dad said, our son is 8 years old and also has autism. His prior experience with a minor procedure was very traumatizing. Children can also pick up on parental anxiety. So if we can decrease the parental anxiety, it's going to help the child in the long run. So remember Milo's mom, who said it was very overwhelming preparing for surgery. We were traveling to have surgery with a new team in a city we had never visited before. She also said, but the team in Pittsburgh made this as easy as possible. The social worker assisted us with securing housing, flights, transportation from the airport. This took that added stressor away so we could focus on Milo. So that's one of the things that we really try to help our families with. Even if they are a local family, they may not be able to pay for gas to get here, or they may need some assistance with that. So what can we do to help them? The other part of our preoperative preparation plan is that clinic visit with the surgical team. So prior to that clinic visit, a lot of the assessment, like I said, assessing the family and the child, how they learn, what their cognitive level is. What do they know about their procedure? When we talk about complex transposition and we have, we just, in all these lectures, we just talked about how different each patient is. Quite frankly, it's hard sometimes for us to wrap our brain exactly around what this is going to look like. So to be able to explain that and to be able to have the families understand that, I think is really important. And then you have a child, which could be a 2-year-old, a 5-year-old, in differing developmental levels. So you need to look at all of that and really tailor your discussions with the families. Our clinic visit, or the clinic visit with the surgical team, I would say is probably 80% education and talking, sitting down, explaining to them what's going to happen. And we utilize our child life specialist and our social worker as needed, depending on developmental age, what needs to happen. Oftentimes, it's one of our advanced practice providers, so I'll go into the room with our child life specialist. We have a pictorial that we give, and it shows the kid what it's going to look like when they show up in same-day surgery the day after, and what it's going to look like when they go back to the OR, what it looks like in the OR, what it looks like in the ICU, what to expect when they wake up, what to expect when it's time to take some of the tubes out. Obviously, catering and tailoring that to the developmental age of the child. Timing is also dependent on what we tell them. You're not going to tell a 3-year-old or a 4-year-old about a surgery 3 weeks before, because that's just not developmentally appropriate. The discussion, so we discussed the surgical plan and the goals of the repair. And this is where all of our amazing new modalities come into play. The 3D models are just, I can't say enough about it. The families, I think Dr. Lanford had talked about it before with one of her families. It's just a tangible way that they can see what this looks like, and to be able to utilize that in our education and teaching, I think has really helped the families. They obviously are given handouts. We are, giving them a roadmap to what their heart looks like and what it's going to look like. I always start my discussion out with going over what a normal heart is, so you're comparing the two, and I think that helps families understand. And obviously, you have some families that want to know everything and some families that only want to know the minimum. So you really have to tailor your discussion and talks with the family around what their needs are too, which is why the assessment prior and the assessment during is really important. During our clinic visit, they also get to meet the surgeon, spend as much time talking about whatever they need with the surgeon, and I think sometimes that just takes, I've seen families just literally just kind of relax right in front of you once they start to hear what really is going to happen. And I think it's important because it was scary not knowing. Remember Ethan's mom. It was scary not knowing what was going to happen the day of surgery. I was easily frustrated. Until we had our clinic visit with the surgical team. They walked us through what to expect from the moment we walked into the hospital, and it seemed less scary. I've had families come in and say, so surgery's going to be 12 hours, right? And I say, I hope not, but that's their perception, because whether they've heard that from other families or they go on the internet and maybe don't have the right resources, that's what they're hearing. So our goal with this whole pre-procedural plan is to give them the information they need, have them as prepared as possible. We can't prepare them for everything, but we can do our best to do a good job of that. Properly preparing the child will reduce anxiety, clear up misconceptions, like I said, familiarize the child with the process, the child and the family. So each child is going to be talked to on a different level. Some kids we can't talk about, like there's going to be a tube there, but we don't talk about what that means afterward. In older kids, we do. And we talk about what things will help them through it, like guided imagery, deep breathing, things, and distraction techniques, and things that we will do in the hospital to help them so it's easier for them and they can progress through the surgery easier. And it gives them a chance to ask their questions, both the patient and the family. You have to really tailor your talk I can't say it enough, to the developmental level age of the child and with the parents' input. We have some families that they don't want, we have Child Life take the child out, or we have the child go out of the room while we talk to the families a little bit more in depth. You really have to be cognizant of that. We talk about the sights, the smells, the sounds that they may incur across the recovery period. And our whole goal with all of this is to make it easier for patients and families, but also when they're in the ICU and when they're in the step-down unit or when they need an echocardiogram after surgery or even post-operatively, that the family and the patient has some coping mechanisms that they can help get themselves through that. We use problem-focused and emotional-focused coping skills, things like conscious breathing, progressive muscle relaxation, guided imagery, and distraction. We discuss the supports available for blood draws, chest tube removals, and other procedures encountered. And during that clinic visit, the patients have to go and get blood work done, and they have to get an x-ray. Child Life will walk them through that and be there for them and really support them. They can also support them the morning of surgery too. So we really just kind of cater and tailor a plan for that specific patient. So remember Noah's mom, she was so worried about how her child was going to handle the hospitalization. She said, once we met with Child Life and the surgery team, I felt more at ease knowing we had a good plan to help my child through the procedure. Here at Children's, we have a new program that was started not too long ago called that was formed an adaptive care team. And what this is, if a child has a developmental disability, if initially it was developed for patients that had autism, but they will do this for any patient who may not, we're really worried about how they're going to struggle through this process. But they'll meet with Child Life, the parents will, fill out a specific questionnaire, and a plan is put in place that is then put into the medical record to alert the whole care team that, my son, this patient's autistic, and if you walk in there with a cap on your head, he's going to lose his mind, giving other ideas on how to do it. And so it's right in the computer system, and you can see this. We did this recently with a family, Bradley, and whose family was actually traveling from Texas, and they were very concerned because this kid, they couldn't even go to the cardiologist and get a blood pressure on him and he was 8. He said, the adaptive care team worked with my wife and I to understand his developmental needs and communicated to the entire care team. It made all the difference in the hospital stay. And it wasn't easy. It was a challenging hospital stay, but with everyone's support, it really ended up, I think, in a good place. So the key is having systems in place to support the patient and family during this complex congenital heart surgery is of the utmost importance. And here we have a team of nurse practitioners, PAs, that really do all of this, with the surgeons, but we also have Child Life, social work. We work with our neurodevelopmental psychologists, our nursing staff, even the cardiologists and the cardiac intensivist and the anesthesiologist. Everybody needs to be part of this. I think it's really important, and we have to remember this is one of the most stressful times in these families' lives. And they may be acting out because of that stress, but it's something that we need to be able to be there to support because it's only going to end up helping them in the end. And I'm going to close with Monica, who said, we always knew she was going to need open heart surgery, but hearing it was time to schedule was one of the most overwhelming moments of my life. We got through it because of the entire team of surgeons, nurses, ICU doctors, child life specialists, APPs, cardiologists, social workers, who not only took care of Amara, they took care of our family. And I'll end with that.